So we're going to talk about what bothers you about your appearance and what you'd like to improve.
Sure. Like some of the deep wrinkles here, like between the brow. My eyes get really squinty when I smile, kind of close up a lot. I don't know, that's probably mostly it. Mostly probably the forehead.
Okay. Do you notice this?
More recently, yeah, than before.
Okay. So you make certain faces that cause these wrinkles. These are called, once you've been making these faces for a while, the wrinkles that set in, they're called static wrinkles. So when you don't make the expression, the wrinkles are there. So you have them along the top. You have them here. You have them across your nose. You have them around your eyes. You have this one. This one you have because you are raising your chin like this. You're also going to show signs of aging here because you make that frowny face, that I don't know face. You can try to make it. And it brings the corners of your mouth down. And because you're thin, you don't really see it, but with age, this is going to jowl. And then the corners of your mouth turn down. And when they turn down, that's like a frown. Looking in the mirror, just kind of tell me what you think you would like improved in your appearance.
Some of the deep lines across here, maybe some of the finer lines.
What you're doing with your lower face is a lot of this, and that is going to exacerbate signs of aging. And then with time, your corners will be turning down because you're doing a lot of that expression that turns them down, and then you bring your chin up, and that causes this wrinkle. So then this is going to show signs of aging in the sides. So we'll get that to relax, and we'll get this to relax as well. We are also going to address these lines, the lines on the side of the nose, and that's from Make a Something Smells face. There you go. All of these need to relax. These between the brows will relax, and your entire forehead will relax. And we will also get the sides around your eyes to relax. See if we can open up the aperture of your eye just ever so slightly by injecting all the way here. And you've never had tox before? Never. Okay. So let's talk about what can happen with tox, right? We know what we wanted to do, but we also need to inform you about what could happen as a potential unintended side effect. So first potential unintended side effect happens when tox is injected kind of lower on the forehead. If it's injected anywhere about here, you could have an unintended side effect of a droopy lid, of a droopy brow. If tox is injected down here below, you can have an unintended side effect of a droopy brow, and that may look like that. So we're gonna avoid that by injecting it higher and indirectly, hopefully relaxing this lower line without actually injecting down here. Also going to inject here and in the middle to get it to relax and not move so forcefully towards each other. Now I'll show you on a skeleton. This is a notch. It's a survival mechanism that we all have in case of injury to the orbital rim, that we don't damage the vessels and the nerve that are housed in this notch. And I can palpate and feel this notch right there. If any of the toxin that we inject about here on this area, so on you that would be here, if it leaks in here, that could cause this kind of a look, and I'll do it for the camera. A heavy eyelid. So that's called litosis. Because it's not directly injected into here, it doesn't typically last as long as the entire treatment does. This treatment should last you about 4 months. Most people do this treatment 3 times a year. Some do 4, but most do 3. So the unintended side effects are typically not lasting as long as the treatment because we didn't really intend to inject right into this notch. We didn't really intend to inject into here. So if we inject a little bit higher, even up here, you could have some leaking of the medications down lower into this part of the forehead muscle, thereby indirectly relaxing it, which is not what you want. But again, because the majority of the dose goes higher and some of it just diffuses and leaks down, you could have that as an unintended side effect. It doesn't happen very often to women your age. It happens more often to women who are older and have a lot of skin laxity. So if skin is lax, there's more chances for diffusion. Does that make sense?
Yeah.
Okay. So when I inject you, you will feel me palpate this notch and hold it, kind of hold your muscle up so that less chance of inadvertently hitting the vessel and the nerve that are here, because they are responsible for moving this eyelid muscle up and down. If that does happen, there are eye drops we can give you to help reverse that. But eventually, these are both reversible. Eventually, within 3 months, the unintended side effects will go away, and I mean you'll have some muscle relaxation probably into the 4th month, but some people don't end up with the 4th month. Some people really end kind of the treatment at the 3-month mark and need to be re-injected, and that more depends on your metabolism. Now let's talk about your lower face. Move your chin up. We're going to relax this muscle and kind of move it down, and then you won't be raising it up, increasing this. Now these muscles are not going to relax immediately in terms of visually. We'll relax the muscle underneath, but the wrinkles are going to stay for some time. They will continue to improve over the months. What has happened to your face is, an analogy would be to take a piece of paper and start folding it back and forth. If you fold this piece of paper back and forth many times over years, it's going to crease. If you want that crease to go away, what you need to do is to place this crease under something that's heavy, like an old white pages. But if you keep picking up the white pages to look and see if the crease is gone, or start creasing it, it isn't going to flatten out as fast as you'd like it to. So the key is to inject, get your muscles to relax, thereby stop the movement. And then within a month or 2, your lines here are going to continue relaxing, and they're continuing to get better until it wears out and you start moving again. When you start moving again, they will come back because the movement is back. Does that make sense? Okay. So those are the unintended side effects. We have to talk about them because we're injecting an FDA-approved medication, and we have to inform you of what may happen. These things don't happen very often, but when they do, no one's happy. You're not happy, I'm not happy. I can tell you with 100% certainty that any good injector would much prefer that these side effects and complications happen to them and not to their clients. And I'm the same way. So we're going to hope and believe that things are going to go well, and I try my best making sure you have a good positive outcome in terms of a good aesthetic outcome coupled with minimal complications. Does that make sense? Okay, so we'll go through and we'll sign an informed consent that we've talked about this, and we're going to use FDA approved medications. I will show you the expiration date. I'll get everything drawn up so you can see what we're doing and kind of follow the process along. Any questions? Okay, sounds good. The medication that I will use to inject will begin to act on your muscles on about day 4. On day 3, you may see changes in how things are moving, and in 2 weeks it will have fully set in, and you will see exactly how things are going to look for the next, let's say, 3 months, for an example. And then when the tox wears off, it doesn't wear off immediately overnight. It starts to wear off slowly, and you're seeing that your movement is kind of regained. And with that are the wrinkles, unfortunately. So to keep up your kind of best look is going to be to get injected 3 times a year. Dosing of toxin can be a point of a lot of question, and why this many units or why that many units. With all FDA approved medications, FDA tells us what is a safe and an effective amount of medications that we can inject. And just as it is with ibuprofen, let's say if you have a headache, you have a choice. On the bottle it says you can take 2 or 3 tablets. And for most people, 2 would be enough. For some, they would really need that third one, and that has to do something with how this person is metabolizing, how bad their pain is, and what they weigh, right? So someone who weighs 120 pounds will probably be okay with 2. Someone who is weighs more, closer to 200 pounds, they're probably used to taking 3, and that's what they need. And the dose is a variable within some kind of a range, as we talk about. We look at you, we look at your features. Now, men typically get more units because their muscles are bigger. That's just how they're made. So when I look at someone, I consider everything. I consider how they look, how much movement we're trying to prevent. We also look at your structure, your bone and muscle structure, and you can really see how muscular someone's face is. Again, men tend to have very strong muscles here, so we need a higher dose to relax that, and that's typical, normal, and expected. Within women, there's also variability. Some are very petite, have small features, and so their muscles are very small. Some women have, kind of more robust features and larger muscles that we need to relax. So that's how we come up with the dosage. Now, the dosage here is, they talk about 20 units in between your brows. That's pretty typical. It varies between 15 and 20 on an average woman. Men are probably closer to 30 units or 25 units, something in that vicinity. When we talk about the forehead, now that's when the complications can happen in terms of a heavier brow look. If a lot is injected and your forehead is very relaxed, we may have an unintended side effect of relaxing your brows so much so, and relaxing, the forehead, that the brows aren't being held up anymore. Here at Eternal Beauty Medspa, I inject you with a conservative amount of units on the top. It's hardly ever 20. Some people with a bigger forehead, or that we know that they need 20 based on their metabolism, they get 20. We don't start with 20. We probably typically start with 10 or 12. And then when I see you at the 2-week follow-up, we may need to add a few units just to give you the desired effect, and we talk about that together. Some people prefer to have more mobile brows, and that just means that we inject a little bit differently. Some people prefer to really be still and have a completely still forehead in the mid-brow region. We can do that too by adding the amount of units. Around the eye they're recommending 12. That is, all these doses are appropriate. They're not overdosed. And some people can do these doses, and for some people, these top doses give them a longer duration of the toxin, meaning some can come back every 5 months instead of every 4 months. And some people need top dose to just kind of be able to maintain the 4 months that we are expecting it to work for, 3 to 4 months roughly. Around the eyes, we again start lower. We start with somewhere around 8 and see if you need any additional units. And then there's off-label use when we move down to the face. What does off-label use mean? Label use means FDA has done studies, or the makers of Botox, that's Allergan brand, they've done studies and they've submitted it to the FDA. And FDA feels like it's safe and effective in these areas. But we can also inject tox into other areas that are called off-label, but they are the industry standard. Everyone does it and has good aesthetic outcomes. So we feel okay about injecting this product into other areas on the face that has been tried and true and tried for many, many years by many injections all over the world. So when we talk about off-label, we're typically moving away from these 3 areas. And on you, that would be around your nose, so we can catch these, the bunny lines we call them, on the sides, and some people have them even on top of the nose. Then also we're going to move into the lower face, so injecting down here, injecting here and stopping this muscle from pulling the corners down. There are also some folks who get Botox injected all the way through the jawline into the platysma and pulls the platysma up. Some people have really strong bands on their neck that they don't like. It's very appropriate to inject into them too, but we would call that off-label use. Again, safe, effective, but off-label. Does that make sense?
Mm-hmm.
We don't have to sign a separate consent for that. We just talk about it, and the doses have been tried and true. So even though they're not written on a sheet of paper like this from the makers of Botox Allergan, we know how much we need to achieve a safe and effective outcome. Now, on the lower face, we do run into a higher risk of an unintended outcome. What does that mean? That means that there are muscles here and they're tiny. And we know anatomically, I know anatomically where they're supposed to be. And I can see you make the face, so I know what's kind of pulling, what we need to quiet. Sometimes if it spills out into the neighboring muscle, you can have an unintended effect of an uneven smile. Again, that doesn't typically last the entire treatment, but that has happened. Same on the chin. We can cause some asymmetry inadvertently by having the tox spill out from the mentalis muscle into the adjacent muscle, which is responsible for mouth movement. Another place where some people need Botox injected is in the top of their lip, which doesn't sound like we need to do that. That's not a concern for you. That's more like these fine lines, and that relaxes this top of the lip part. What it also does inadvertently is it everts the top of your lip, giving it more of a show. It doesn't really fill the top of your lip with anything like filler would, but it relaxes the muscle that's there and inadvertently pulls it up. So visually it looks like the lip is taller, but not necessarily fuller. We do a very low dose in the top lip because if we did enough to last you 3-4 months, you wouldn't be able to eat or drink, because then you wouldn't be controlling your mouth muscle, your lip very well. So we would do just enough superficially to relax the top fibers, but not really take out the ability of this muscle to move and function normally. Right? Any questions for me?
I don't think so.
Okay, sounds good. So you will see that it starts to affect you on about day 4, the tox we're going to use. And then in 2 weeks, I'll need to see you follow up. And at that follow up, we'll determine if you need any additional units or not. Sounds good?
Sounds good.
Okay.